Hi, I'm Lone Candle. A main point to having private versions of Medicare ran by for-profit health insurance companies as an alternative option to traditional Medicare is to save the taxpayer money by taking advantage of efficiencies gained in private competition and private flexibility, while also giving Medicare beneficiaries more choices in their senior health insurance benefit. That main point has been a total failure. Compared to traditional Medicare, Medicare Advantage, the private version of Medicare since 2003, has cost more per similar beneficiary every year since its creation. One of the main points of letting private health insurance companies make profits from our Medicare program is to save the taxpayer money. And on the face of it, that has been a consistent failure. Medicare Advantage does offer additional benefits compared to traditional Medicare, like access to dental and vision in one premium, a maximum out-of-pocket without buying an additional Medigap plan, and lower premiums, but has disadvantages too, like a tighter provider network and a higher chance that the medical services a doctor decides to give you will be blocked by the insurance company. If the benefits of Medicare Advantage outweigh the negatives in the first place, then the need for reform may simply be making sure that, per similar beneficiary, Medicare Advantage costs the taxpayer the same or less than traditional Medicare. This is especially important due to the country's deep debt and deficit, whose future growth is driven by Medicare. Advantage plans do have lower medical spending per enrollee, but it's difficult to tell to what extent this is due to selection effects or the differences in Advantage policies. I'm convinced by enough studies that some of the differences in spending is due to Advantage's controls and limits. This is primarily done by narrow networks and discouraging and denying care. Some of this lower healthcare use is efficient because it results from less unnecessary care. But some is reduced necessary or helpful care, and discouraging or denying that makes the patient worse off. Medicare Advantage has had the problem of having a healthier pool than traditional Medicare, so it's hard to tell to what extent Advantage's lower medical spending is caused by efficiencies or this selection bias. Advantage companies are able to advertise to and incentivize a type of person to sign up for them. This means their apparent efficiencies and the health of their customers are biased by the private companies selecting healthier people. The unhealthy people are still insured, but by traditional Medicare. This means private companies are ripping off the government by taking government payments and premiums from the healthy and letting the taxpayer pay for the more expensive sick people. Worse, among people who get sick while in Medicare, there is a net movement of these people from Medicare Advantage to traditional Medicare, meaning these companies take the government's money for years, and then when the person needs expensive healthcare, the government pays for that too, because the person switches to traditional Medicare when Medicare Advantage doesn't meet that sick person's needs. Prior authorizations, denials, networks, and other cost control processes do control costs and limit some unnecessary spending, but also are a huge hassle for patients and providers, resulting in care being in the hands of insurance companies just as much as in the doctors actually examining the patients. If the care one needs is not in network or is not approved by the insurance company, you're fucked, either your health, financially, or both. One benefit of Medicare Advantage is that when Advantage plans are prevalent in a geographic area, medical providers may adjust to deal with the demands of Advantage plans, and these adjustments often lead to more efficient and cheaper care. Sometimes these adjustments are made for all patients, not just Medicare Advantage patients, so traditional Medicare would also benefit from the demands of Medicare Advantage. However, these benefits are smaller than the overpayments to Advantage. Medicare Advantage has higher administration costs than traditional Medicare, but at least some of these administration costs are recouped by those bureaucracies forcing patients and medical providers to act in ways that cost less money. However, Advantage plans also increase the administrative costs for hospitals, doctor offices, and other providers. Systematic reviews comparing Medicare Advantage and traditional Medicare find that Medicare Advantage enrollees have more difficulty affording healthcare. Other studies find that the percentage of people with issues getting care due to costs is similar between Advantage and traditional. Whether healthcare is more affordable to someone on traditional versus Advantage will depend on one's medical situation and one's supplemental insurance. Traditional with a supplemental means healthcare costs should be covered. Traditional without a supplemental means the cost will be covered, but there is no out-of-pocket maximum, so one's personal costs can add up even if Medicare pays a majority of the bill. With Advantage, your costs may not be covered at all, so there's a chance that you will get totally screwed if the facility or procedure or doctor you need for your ailment happens to not be in network or covered by your Advantage plan. Most studies find similar health outcomes when comparing Advantage and traditional. Studies have found that Advantage is no better than traditional on mortality, readmission rates, and patient experience. Various studies find better outcomes on specific things for Advantage over traditional, including the outcome of reduced mortality, but it's not clear that Advantage is making that happen rather than this being the result of selection effects. A smaller number of studies find better outcomes in traditional. Many studies find no difference in outcomes. There have been attempts to reform the overpayment problem, but insurers are good at gaming such attempts. They are more nimble than government bureaucrats and legislators. So, the questions are, is Medicare Advantage a net good and just has an overpayment problem that needs to be fixed? Or is Medicare Advantage a net bad and should be gotten rid of, possibly because the payments problems will never be fixed? Additionally, should Congress improve traditional Medicare? Many discussions of Medicare Advantage act like traditional Medicare is a static program immune to change. Congress can make traditional Medicare better and could even use the money saved from ending or reforming Medicare Advantage to do so. Medicare Advantage needs to be better than traditional Medicare because of inherent advantages in the private market, not because Congress won't make basic changes and improvements to traditional Medicare. In the end, I say we either need to get very tough on Medicare Advantage to end overpayments, or we need to end the program altogether. One of the main points of Medicare Advantage was to save the taxpayer money. Advantage has failed to do that and has resisted reforms to try to fix this problem. It may be that for-profit insurers will always outwit regulators and consistently rip off the taxpayer. If this is the case, then Medicare Advantage should be ended. There are many proposals to fix the overpayment system. If we can implement them and consistently enforce them in such a way to make Advantage cheaper to the taxpayer than traditional, like it was supposed to be, then I'm open to continuing the Advantage program for the sake of its real efficiencies over traditional Medicare. History and what is Medicare Advantage? In the 1970s, some Medicare beneficiaries got their Part A and Part B coverages through private health plans, first authorized in 1972 and with the first private plans available in 1976. This was the start of what later became Medicare Advantage. Ronald Reagan signed legislation that allowed Medicare managed care plans to be sold. In 1985, when this legislation went into effect, less than 5% of seniors were in such plans. By the end of the 1990s, that was almost 20%. Medicare Part C, which later became Medicare Advantage, was created by a law passed in 1997. It went into effect January 1999. This program, Medicare Choice, wanted to give more choices and flexibility to beneficiaries, but it had issues with plan availability and sustainability. Medicare Advantage was created by Congress and President George W. Bush in 2003. Bush said Medicare Advantage would lower costs, expand benefits, give more choices, and make care better. This renamed most Medicare private plans Medicare Advantage. It was after this act that Medicare Advantage grew significantly. In 2023, For the first time, more than 50% of eligible Medicare beneficiaries were enrolled in Medicare Advantage. Beneficiaries in both Medicare Advantage and traditional Medicare pay Medicare Part B premiums. Traditional Medicare is the government-run insurance benefit for seniors. It covers 80% of costs from outpatient services. Inpatient services like hospitalizations are fully covered by traditional Medicare after a deductible for 60 days of hospitalization a year. For prescription drugs, traditional Medicare offers Medicare Part D run by private insurance. There is no out-of-pocket maximum with traditional Medicare unless one buys a supplemental Medigap plan that covers most out-of-pocket spending. Some traditional Medicare enrollees have supplemental coverage through Medicaid, their employer, or their union. Medicare Advantage, also called MA or Medicare Part C, is a Medicare option where instead of getting government-administered Medicare, a beneficiary chooses among private insurance programs. These private organizations get a payment from the government for each person enrolled. Per county, Medicare sets a benchmark equal to a percentage of the average cost of a beneficiary in traditional Medicare. The benchmark ranges from 95% of the average to 115% depending on the amount of spending in that county. Advantage plans submit a bid that is supposed to be their estimate of the total costs to cover Medicare benefits for an average enrollee in that county. The bids are then multiplied by a risk adjustment score based on demographic and diagnostic factors. If Advantage plans bid below the benchmark, they can keep about 2/3 of the difference, which is required to be used to reduce cost sharing and improve benefits. This amount that they keep is called a rebate. Premiums, coinsurance, and deductibles vary across Medicare Advantage plans, but the premiums tend to be low. Some are even $0 after Part B premiums. Advantage plans are required to have a maximum out-of-pocket limit. The plan can also include drug coverage. Medicare Advantage is cheaper up front. Traditional Medicare with a Medigap plan can save money if one needs expensive medical services. Unfortunately, many people can't afford a Medigap plan, so Medicare Advantage may be their best option. In 2023, 7 large insurance companies were 84% of the Medicare Advantage plan enrollment. Medicare Advantage offers thousands of different plans.